Good morning, everyone. My name is Dr. Shiva Prasad. I'm the consultant interventional cardiologist. Today I'm going to talk about hypertension or high blood pressure. We hear that often in the community and in the clinical practice. This is a common condition that I treat. What is high blood pressure? Many people ask, and essentially this is the pressure that you measure in your blood vessels. As the age goes up, your blood vessels get stiffened. With that leads to raise in blood pressure. And when we take a step back and when we look at it, what causes hypertension? 95% of the cases there is no obvious reason, and in 5% of cases it could be due to kidney problems or any endocrine disorders. Why should we treat hypertension in general? Hypertension is a risk factor for developing heart disease such as heart attacks, heart failure, stroke, and kidney disease. Ultimately, when you don't treat these to minimize above events that can lead to life-threatening conditions. What labels as hypertension is anything. When we look back, the normal blood pressure readings are 120 by 80. Anything more than that will be considered as abnormal blood pressure readings. When the blood pressure readings, the systolic, the top number is more than 130, then it's labeled as grade 1. That's 130 to 139. And if it's above 140, then it's called grade 2. How we can minimize the risk of developing hypertension? The first and foremost important aspect being physically active. At least 30 minutes physical activity daily certainly helps. Second aspect being reducing the alcohol intake. Obviously, alcohol intake increases the fluid retention and that can pushes your blood pressure. Third one being reducing the weight. Obesity certainly increases the risk further. And fourth one, or you can call it that's most important in lifestyle management, is diet modification, including salt restriction or reducing the salt. With these four, we certainly minimize the risk, but having said that, in common practice, not many people follow all those four, and despite you following, this can bring down the blood pressure up to a certain extent. Majority of people eventually will require tablet treatment. When we start treatment, obviously, we aim for certain number to bring down, and I see often people worry about 140, 150. But our aim ultimately when we start treatment is to bring down the blood pressure under 130 by 80 if it's above 65 years age group. And what about above 65 years? And are those people who have diabetes, heart disease, stroke, these patients certainly should have blood pressure under 130/80. But not uncommon to see young individuals to present clinic with the high blood pressure issues. And I try to reassure them in a way, we are not treating absolute numbers in this engaged group. Before I start any treatment, I not only look at the absolute readings of the blood pressure, we look at their risk of developing cardiovascular events over next 10 years. i.e., if a 40-year-old doesn't have any diabetes, hypertension or smoking, then you might not necessarily treat their blood pressure if it's around 135 or 140. We calculate these 10-year cardiovascular risk based on certain calculations, and if somebody has diabetes or high cholesterol, then certainly even young individuals needs their blood pressure addressing.